Welcome to Public Health Ideas. I'm Sandro Galea. I serve as Dean of the School of Public Health at WashU. Today I have the privilege of speaking with Professor Lindsay Stark, professor at the Brown School at Washington University. Today we're going to discuss Professor Stark's paper together with Professor Lana Seff, who couldn't be with us today, in Social Science and Medicine, Meaning-Focused Coping as a Cultural Process, a mixed quantitative and PhotoVoice study of adolescents with Arab backgrounds overcoming stigma and harassment. Lindsay, let's start with where the work came from. What led to this work? How did the study come about?
So we have been working with the Qatar Foundation International for a little over 7 years now. And this is an educational funder who provides money primarily to schools to support Arabic learning. And what they were finding was that a lot of the students who were coming from Syria, Iraq, Yemen, and other countries in the Middle East were not really fully able to take advantage of the Arabic language courses that were on offer because they were really struggling with other very real mental health and psychosocial issues. And so they came to us and sort of said, can you help us to better understand what's going on with these kids, what kind of supports would be helpful to them, and how we can help them get to their educational and other goals.
That's interesting. It's an interesting genesis of a work like this. Let's talk a little bit about the core problem, which is talking about mental distress, suicidal ideation among adolescents. What's the scope of the challenge and how does it intersect with the broader issue of mental health that we talk about a lot today?
So the CDC has been doing studies on adolescent mental health for a number of years, and broadly speaking, there's been a huge decline between 2011 and their most recent report in 2023 in terms of adolescents' well-being, in terms of suicide ideation and attempts. In our own study, we have found that foreign-born students, especially those coming from Middle East and North African region, are at particular risk of suicide ideation, and have been looking at a number of stressors and predictors of suicide ideation and resilience for this population. And so some of what we have found is that a feeling of school belonging is actually protective for these students, that hope is predictive of resilience, that number of stressful life events is negatively correlated with suicide, with resilience, and positively correlated with suicide ideation.
Tell us how this particularly now is an issue around adolescents from Middle East and North Africa.
So within the foreign-born population, of course, we know that a lot of these students are coming from war-torn countries and have experienced really stressful displacement experiences along their journeys to the United States. But what we tend not to think about as much are the daily life stressors once they arrive in America. So having to navigate new systems, new norms within school, within their community, and then also layered on top of that, increasing feelings of Islamophobia around the country and other types of discrimination. So all of these are factors that have been influencing and affecting the mental health of this population.
Now let's talk about the study. Tell us a little bit, what did you set out to answer in the study?
So this study draws on two of our data sources from this larger study of adolescent lives after migrating to America. So we wanted to look quantitatively and qualitatively at the relationship between mental health and coping, and really thinking about how do experiences of mental health and coping vary for different populations based on their time in the United States.
Now, the work is grounded in, it's a bit of a mouthful, the intersectional theory of cultural repertoires in health. Can you just explain that briefly and how you use that theory to guide the work?
Sure. So the theory of intersectional cultural repertoires in health essentially suggests that we all have ways of coping. And, coping theory more broadly has, elements of it that are focused on problem solving and addressing the problem, emotionally driven solutions to help assuage any feelings of distress, and then this other component, which is really around meaning. And this is really, I think, where the cultural piece comes into play. And so it's acknowledging that people have many identities, not just one. And these cultural repertoires essentially are a toolbox that people can draw on for different schemas, different norms, different ways to make meaning of their sources of distress, and hopefully use those in terms of positive coping mechanisms.
So I was drawn to this idea of meaning. Tell us a little bit, what do you mean by meaning?
Sure. So actually, I'm going to use a different, an example that's not actually from this study to try to make this point. So a lot of my prior work was looking at children engaged with fighting forces, more colloquially known as child soldiers. And you think about the just distressing experience of being abducted and engaged with armed groups. And so a child who creates a schema for themselves and says, my story is I've been abducted, I've been used for warfare, that's going to be extremely distressing, and I've had to do all of these things that are kind of outside of what I would normally want or think about doing. An alternative interpretation that we've seen are children who are abducted and they view themselves as freedom fighters. I'm actually, the meaning that I'm making from this is I'm part of a revolution and I'm part of something that's going to change the course of history and the course of the way my country has been running. And so depending on how you interpret, what kind of meaning you make from your experience, it can have really, really long-lasting implications in terms of your own well-being.
There are a lot of interesting things about the study, but one of the things I also found compelling was the data that he used. There was using quantitative data and also PhotoVoice data. It's an unusual mix in one study. Can you tell us a little bit about the data, what data you used, and how you brought that together to come up with conclusions?
Sure. So the quantitative data, all of the data that we use comes from the Detroit metropolitan area, or the DMA. And the quantitative data comes from about 170 students of Arab heritage. We divided those into 3 different groups because we were, again, interested in looking at some of these differences. So we had a group of newcomers, so students who had been in the country less than 5 years. We had established immigrants who had been in the country longer than 5 years. And then we had Arab heritage students who were essentially second generation, who had been born in the United States from parents who had emigrated to the United States. And in the quantitative data, we were looking at both their sources of distress and also their knowledge and use of help-seeking mechanisms and people they could go to for help. And so we found some really interesting differences in that data in terms of the newcomer group, for example, in terms of emotional distress, not going to their parents at all, not seeing parents as a resource that they would be able to draw from to derive support or navigate a path to wellness. Whereas students who had been born into the United States were slightly more likely to engage parents. We saw some interesting patterns overall where the longer individuals had been in the United States, the worse off they were. So that middle group, actually, not the group that were born in the United States and not the newcomer group, but this group who had been in the United States for longer, experienced higher rates of worthlessness, loneliness, and suicide ideation compared to the other groups. And the longer these students had been in the U.S., the more they knew about mechanisms that they could access for support and help, but the less they were using them.
Interesting. So what does this work point to? What does this work point to in terms of intervention solutions?
So the qualitative work, actually, the PhotoVoice work really helped elucidate, I think, some of these pathways and the ways that students were making meaning and drawing on their cultural resources in different ways. And so some of what we learned through that data were the ways that students, for example, newcomer students who were struggling with mental health and feeling that they were not able to go to their parents because they were going to be stigmatized or told that this was a private issue that was only kept in the household. Instead of saying, well, I'm going to push that part of my Arab identity away, what they ended up doing was creating a new boundary and saying, okay, this is the older Arab generation's view on mental health. But we actually, as younger Arabs, believe that you can be, a good student and a good daughter and a good son, and also be struggling with these mental health issues, and relied much more on their peer supports, for example. And so finding opportunities, finding interventions, finding ways for students to be able to access different parts of their cultural heritage in ways that is going to allow them to develop these narratives or make meaning in ways that it's going to allow them to positively access the supports they need are different ways that we can be thinking about mental health interventions, school supports, community supports, and engagement.
I think the issue of stigma, mental health, particularly in immigrant groups, is such a difficult issue, and obviously one that's gaining in importance. So last question, what gives you hope in doing this kind of work?
The students, without question, give me hope, and I think, through the PhotoVoice exercise, one of the things that was so interesting was, they were all given individual probes to think about what is belonging, what is well-being, what do I want to share about myself, but then they would come together and share what they had, how they had conceptualized the answers to these questions, and collectively sort of negotiate and create a shared dialogue and a shared schema and understanding for these things. And then we're able to think 2 steps forward to then, okay, what is the collective action that we want to be taking? So we've had students that have organized events to teach their school leaders about what belonging and what well-being means to them. We have students who are sort of collectively engaging in peaceful activism and resistance. So I think there's a lot that they themselves are hopeful about, and that definitely gives me hope.
Thank you. It's terrific work. Thank you for doing this work. And thank you for being part of the conversation.